I get a lot of questions about how I evaluate a shoulder and what my differential diagnosis looks like for my shoulder patients. So, a simple way that I think about it is with something that I call, or that was taught to me as the layer system, and I can't take any credit for this layer approach. When I started working at where I am now, one of my mentors was Pete Drayevich, and he was seeing a lot of hip arthroscopy patients. And similar to the shoulder, there's a lot of different things that can cause pain around the hip. So Pete used this approach, and I'm pretty sure Pete came up with it, called the layer approach. And essentially, what you want to think about is identifying potential pain causing structures from the deepest layer all the way out to the most superficial layer, right? So from the bone all the way out to the nerves. And I think, applying this to the shoulder has definitely helped me try not to miss any potential pain causing diagnoses around the shoulder. So if you think about the layers of the shoulder, first we've got the bony layer or the osseous layer. So if I'm thinking from a differential diagnosis perspective, maybe it's a fracture of the bone, right? So if someone comes into shoulder pain, if you go from layer one, which we call the bony or the osseous layer, it could be a stress issue with the bone, it could be a compound fracture, or just a fracture if there's trauma to the bone. So number one, you've got to try and rule out or in that osseous layer. The next layer is a layer of static stabilizers, right? So that's where we have our labrum, that's where we have our capsule and ligaments as well. So what are some potential issues you could have at that layer? So of course, if there's trauma and there's a frank dislocation, you might think anterior inferior labral tear or capsule tear. If it's progressive onset of anterior shoulder pain in an overhead athlete, maybe capsule. It could be posterior directed force, and you're thinking posterior labrum or posterior capsule, slap tear. So that layer two, what you want to think about are any issues at that capsule labral area and that inert tissue or those static stabilizers. After you've cleared or you've gone through round or layer two, now on to layer three, we're talking about our dynamic stabilizers. And what are our dynamic stabilizers? Those are obviously your rotator cuff muscles that surround the joint. Then I'll even include some periscapular muscles as well, the mid traps, the low traps, and see how they're activating and firing, which potentially could lead to some winging that we would look for as well. So the dynamic stabilizer, layer three. And if we go one layer further than that, now we're going above, and this is a layer that I think is really important that we don't miss, and that's your neurovascular layer. So, we see a lot of our overhead athletes, or a bunch of them, will have, onset of thoracic outlet, or your swimmers, where they just complain of just a fatigued arm, quicker than usual, a feeling of just sensation loss or paresthesia that doesn't match up with some of your dermatomes or particular nerve testing. So for some of those just vague issues, you might want to think neurovascular layer or that layer four. So that is really something that has helped me as I am diagnosing a new shoulder patient or someone that comes in. Typically, with your non-surgical patients come with general shoulder pain. That helps me organize my evaluation and really not miss anything. So that's really a comprehensive look from layer one to layer four. So again, you're going bone at layer one, static stabilizers layer two, then we go out to our dynamic stabilizers, and then lastly, your neurovascular complex for potential issues. And including neurovascular, of course, we want to screen the neck for any kind of potential radicular symptoms. So that's definitely helped me. Thanks to my mentor Pete for that, and I've applied it to the shoulder. And if I'm teaching our fellows or students, I'll definitely make sure that we go through that, because there's so many different structures around the shoulder that can cause pain, and it's very easy to get sort of sidetracked and lost in the weeds. So I think that helps me keep structure, and it helps organize my evaluation. Then we could have a targeted treatment approach from there. So hope this helps all of you. Please like, subscribe, tell your friends, and plenty more videos to come. So talk to you soon.